What is PCOS, and why should we care? Polycystic ovary syndrome, or PCOS, is a common health problem that stems from an imbalance of reproductive hormones. It's a complex condition that affects the ovaries, the organs responsible for producing estrogen and progesterone, hormones that regulate the menstrual cycle. The imbalance of these hormones can lead to the growth of small cysts on the ovaries. But why should we care? Well, PCOS affects a significant number of women of reproductive age. It's not just a minor inconvenience. It's a major health concern that can have serious implications if left unchecked. It can lead to various health challenges, like hormonal imbalances, infertility, and metabolic complications. Knowledge is power. The more we understand about PCOS, the better equipped we are to manage its effects. By gaining a solid understanding of this condition, we can work towards improving women's health one step at a time. Understanding PCOS is key to managing its effects and improving women's health. What signs indicate a possibility of PCOS? Polycystic ovary syndrome, or PCOS, often presents itself through a variety of symptoms that may seem unrelated at first. One of the most common signs is irregular periods. This can mean infrequent, prolonged, or even absent menstrual cycles. Another symptom is excessive hair growth, medically known as hirsutism. This typically occurs on areas where men usually have hair, like the face, chest, and back. Acne is also a common symptom, especially when it's persistent and appears on areas such as the upper back, chest, and face. Unexplained weight gain is another sign to look out for. Women with PCOS may find that they gain weight easily or struggle to lose weight, even with diet and exercise. Lastly, fertility problems may indicate PCOS. Difficulty getting pregnant is often linked to the irregular ovulation or lack of ovulation associated with this condition. Recognizing these symptoms can lead to early diagnosis and effective management. What sparks the onset of PCOS? This question has puzzled medical experts for years. Let's delve into 5 potential causes that may contribute to the development of this condition. Firstly, insulin resistance. A large number of individuals with PCOS have insulin resistance, where their bodies can't use insulin effectively. This leads to an overproduction of insulin, which may increase the production of androgens, hormones that can cause problems with ovulation. Secondly, inflammation. Studies have shown that women with PCOS often have low-grade inflammation, which can also stimulate the ovaries to produce androgens. Thirdly, hereditary factors. If your mother or sister has PCOS, your chances of developing the condition increase. Though the exact genes involved are still under investigation, it's clear that PCOS often runs in families. Fourthly, the overproduction of androgen. Women with PCOS often produce higher than normal amounts of androgen. This can affect the development and release of eggs during ovulation. Lastly, let's talk about the role of weight. While not a direct cause, being overweight or obese can exacerbate insulin resistance and inflammation, which, as we've mentioned, are key factors in the development of PCOS. While the exact cause remains unknown, these factors contribute significantly to the onset of PCOS. So, understanding these potential causes is a crucial step in managing and possibly preventing the condition. What are the potential complications of polycystic ovary syndrome, or PCOS, is more than a reproductive issue, as it can give rise to many serious health conditions. Let's examine 5 potential complications. First, women with PCOS have an elevated risk of developing type 2 diabetes because PCOS is associated with insulin resistance, a condition where the body's cells don't respond effectively to insulin. Over time, this can escalate blood sugar levels, leading to type 2 diabetes. Second, high blood pressure is another significant worry. Women with PCOS often have higher insulin and androgen levels, leading to weight gain and potentially obesity, both of which can heighten blood pressure. This increases the risk of heart disease and stroke. Thirdly, unhealthy cholesterol levels are another concern. PCOS women typically have higher bad cholesterol and lower good cholesterol levels. This imbalance can cause arterial plaque buildup, resulting in heart disease. Fourthly, sleep apnea is a serious sleep disorder where breathing halts and restarts repeatedly. PCOS women, especially overweight or obese ones, face a higher sleep apnea risk, leading to problems like daytime fatigue, high blood pressure, and heart issues. The emotional impact of PCOS is considerable. Women with PCOS often suffer from mood swings, anxiety, and depression, likely due to hormonal imbalances and the stress of managing a chronic illness. These complications highlight the importance of timely and effective PCOS management. Knowing these possible complications can aid early detection and management, decreasing the risk of serious health problems. After all, knowledge is power, and understanding the full impact of PCOS is the first step towards effective management and treatment. Can we prevent PCOS, and if so, how? It's the question we're tackling now. The answer is a resounding yes. While there's no foolproof method to entirely rule out the possibility of developing polycystic ovary syndrome, there are certainly effective ways to significantly lower the risk. Let's dive into 5 of those. Firstly, maintaining a healthy weight is crucial. Excess weight can exacerbate hormonal imbalances, a key factor in PCOS. So, keeping your body mass index within the recommended range is a good starting point. Secondly, regular exercise, at least 30 minutes a day, can help manage insulin levels, improve menstrual cycle regularity, and even boost mood. It doesn't have to be an Olympic-level workout. Consistency is key here. Thirdly, a balanced diet is essential. Opt for a diet rich in whole grains, lean proteins, and plenty of fruits and vegetables. Limit intake of processed foods and sugars, as these can contribute to insulin resistance, a common issue in PCOS. Up next, regular checkups, particularly for those with a family history of PCOS. Regular screenings can help detect hormonal imbalances or other early signs of the syndrome, allowing for timely intervention. Lastly, don't underestimate the power of stress management. Chronic stress can disrupt hormonal balance, potentially triggering PCOS. Mindfulness techniques, yoga, or even a good old-fashioned walk in the park can help keep stress levels in check. Prevention is better than cure. These lifestyle adjustments can significantly lower the risk of developing PCOS. So, take care of your body, and it will take care of you. How can we treat PCOS? Let's explore this. Initial approach to combating polycystic ovary syndrome, or PCOS, is typically lifestyle modifications. Implementing a nutritious diet, engaging in regular exercise, and maintaining an optimal weight is important. These alterations can assist in managing your menstrual cycle and insulin levels, reducing the associated symptoms. Small, frequent changes can generate significant betterment. Medication marks the next step. A wide variety of drugs addressing various facets of PCOS are available. Birth control pills can help normalize menstrual cycles and decrease unwanted hair growth or acne. Metformin is frequently used to control insulin levels and enhance ovulation. Other drugs like clomiphene may stimulate ovulation to boost fertility. In select cases, surgeons may perform a procedure known as ovarian drilling to stimulate ovulation. This involves puncturing the cyst-laden ovaries with a small needle. This temporary solution might increase pregnancy probability, although it's generally not the preferred option due to potential complications. Additionally, mental health support plays an essential role. The toll of PCOS on mental health can lead to anxiety, depression, or self-esteem issues. Therapies like psychological counseling or support groups offer a confidential environment to share experiences, seek advice, and learn coping mechanisms. It's crucial to remember alternative approaches too. Practices like acupuncture and herbal supplements have shown promising results. However, these methods aren't universally effective and must be initiated only after professional consultation. The key takeaway is that treating PCOS is a highly personalized journey. What succeeds for someone might not for another. The objective is to identify the unique blend of treatments that fit you the best. With the right treatment and support, managing PCOS and its symptoms is entirely possible. So don't despair. Numerous options are readily available, waiting to guide you towards better health. PCOS is a common but manageable condition. We've explored its symptoms, causes, complications, prevention, and treatment. It's crucial to understand that early detection and proactive management can make a huge difference. From irregular periods to insulin resistance, every symptom and cause is a piece of the puzzle. Remember, prevention strategies and treatments are not one-size-fits-all, but tailored to each individual. The more we know, the better we can combat this condition. Awareness is the first step towards a healthier future for those with PCOS.